Thank you very much, and for that great introduction to the network. It's a great pleasure to be here and to start off with the first of the four of the scientific sessions in the launch program today. I'm going to very briefly talk about One Health and try and put this in the context of One Health approaches, in particular to looking at disease emergence events. I'm very pleased that I've been joined in this session by my old friends, Dr. Hayley McGregor and Tom Solomon, both of whom should be known to many of you. Hayley is a very well-known medical anthropologist, and Tom a very well-known medical physician. It's very important for One Health that this program is not just represented by veterinarians like me, veterinary scientists like me, that this represents a true integration of medical and veterinary approaches to disease or infection investigation. It's critical, although we don't have an environmentalist talking this morning's session, it's critical that the environment is considered in all models of One Health. And that's a key part of the integrative approach that I want to take this morning with this work. So I hope that you can all see my screen here now. As I said, I'm going to be talking just very broadly about One Health, and the reason that One Health is obviously so important is around, in this context, is around disease emergence. And the different model, there are many different models of One Health, and but the one that I hope that we can stick with today relates to this wonderful source of all useful knowledge, Wikipedia, a collaborative effort of multiple disciplines working locally, nationally, and globally to obtain optimal health for people, animals, and the environment. Central to this is integrated multidisciplinary approaches to disease investigation and controls, which consider both human and animal and environmental health. And in order to do this, and this has been commented on actually already by Julian, we've got to consider social and behavioral sciences. This means that we need to consider both qualitative and quantitative research. And as Julian commented earlier, when we're talking about disease control, in many cases, and this has been true in animal disease control for centuries, non-pharmaceutical interventions have been recognized as being very effective at ensuring and delivering disease control. And actually, in terms of, well, we've watched the pandemic unfold, many of us working with a veterinary science background have been puzzled by the reluctance of, whilst understanding it as well, but puzzled by the reluctance of some politicians to consider social promotion of social approaches and social and behavioral approaches to human disease control when we know that they are so vital to control diseases of animals. If we're trying to take an integrative approach, there's a very powerful integrative science of mathematical modeling, which can be invaluable in terms of delivering integration. But we do need to consider the social evolution, which involves all aspects of health, from medicine, animal health, and eco-health. This slide is really just to state the obvious. Zoonoses are important for human diseases because of the very large number of diseases which are endemic in humans and are human diseases which originally are derived from animals, and that importance is even greater when we're considering new and emerging diseases. So I want to talk about a model of One Health, and I'm going to talk you through what it looks like a slightly horrendous diagram by breaking it down. Now, a natural science approach, when we're thinking about emerging disease investigations, and the example I'm taking here is viral pathogens that may spill over either directly or indirectly from bats into people. And they may spill over through intermediate hosts, such as pigs, in some cases horses, or other potential hosts. The pangolins have been talked about rather a lot in the last 2 years. We look at the dynamics of these infections in the wildlife hosts, intermediate hosts, and then look at transmission dynamics and impacts on human health in local systems where there is close contact between bats and people. And this is very much a traditional One Health approach to disease investigation. We really want to understand the complexities of it, and I think that the pandemic has really exemplified how structural drivers of transmission, inequalities are so important in considering who gets infection and when. It's really important for us to consider more than just these animal and human interactions. We have to put them in the context of how people behave, how people respond to the environment around them, what the traditional approach is to interactions with animals, be they wild animals or domestic animals in the environment that they live in, and how public health has been shaped to detect and work with those different interactions. That immediately brings in social sciences, and Haley will talk more about them now. The perceptions of what is going on drive many things, including a lot of social and political decision making. And they can be very important in relation to how frontline workers, be they medical or animal health workers, how they respond to different disease situations and how they may spill over, how they may react to them. That obviously is all framed by national policies, in particular around funding, which so often in these cases comes from national government. And that obviously is driven, in the UK, it's driven by the editor of the Daily Mail, which is a joke amongst politicians, but actually has rather more truth in it than many people would care to admit. So politicians are very responsive to what they think people are thinking about. All of that also is in the context of international and global health drivers, be they around policies and policy drivers, or be they around new knowledge that's being developed internationally, or be they around environmental policies, such as those that are being driven through COP26 at the moment. All of this, I think, needs to be considered in the context of One Health. It's a highly complex system, and it's very important for us not to ignore all of the different elements of this. What I want to do is just finish with this one image of a bat bushmeat hunter in Accra, Ghana. This picture for me exhibits many of the challenges of dealing with spillover. Bushmeat hunting is recognized as being a risky business. It's risky because often those involved in it are poor. This side of the road is the man's shop. You can see that just through dress, he's not wealthy. These bats have been taken down out of the tree using the slingshot that you can see amongst them. It's particularly risky because these bats are not all dead. You can see the one on the bottom left is still moving. Bat hunters are often bitten, have very close contact with the prey that they are hunting in order to sell for their livelihood. It's very difficult out of the context of social advancement to see how you can stop people like this who need to conduct these sorts of these practices in order to feed their families. It's very difficult to see how you might be able to stop things like this happening on a local scale. A One Health approach that takes into account social, political, as well as health aspects is important for us to follow and to study in order to best understand how we might deal with these issues.